Greetings, everyone. I have been noticing a lot of different chatter on the different social media platforms, mainly Facebook, about a lot of women and moms suffering with migraines and headaches. So today I thought what I would do is actually address this topic and kind of target what to do about migraines and headaches. And I think because I am a doctor of physical therapy, I just couldn't go any longer without addressing this issue. If you are a headache or a migraine sufferer, you are not alone. There are a lot of people out there suffering with migraines and headaches. I see it in my own office. So I'm very aware that this is a problem. And I'm sorry that you have been bombarded with lots of information out there that can be very overwhelming. Some of it is true information and some of it is myth. Now, I tend to be very open-minded and very open to different approaches. So when somebody has success with a certain approach or a technique that they've learned, whether it's from another medical provider or whether it's something that they've heard from a friend, as long as it's not harming them and it's not going to harm someone else, I'm perfectly open to them doing that and trying it. I'm not opposed to it. It's not my goal today to dispute any information or treatment out there. And it is not my intention to diagnose or treat anyone who is listening to this today. My goal is to start a conversation and to teach about what I know to be true and what I know has worked for my patients who have walked through my door in complete agony because of their migraine and headache symptoms. Let's first chat about why you might have a headache or migraine and what the difference is. I lean on my friend and colleague, Douglas Nelson. He's the founder of Precision Neuromuscular Therapy, which really has revolutionized the way I treat in my practice. And he has just a wealth of information available. I'm going to provide a little bit of basic information from what he teaches, so kind of a summary of what he teaches, but I definitely wanted to give him credit because he's just a phenomenal educator as well as a treating massage therapist who founded Precision Neuromuscular Therapy that has just been such a help to so many people for different things. But for me, I've found that it really works with people suffering with migraines and headaches. So let's kind of dive right in here. Headaches come in many different types. A cluster headache is typically very short in duration, but has a super high intensity. They tend to come in groups or clusters of several headaches over a period of time. Clustered headaches tend to affect more males than females and more smokers than non-smokers. In fact, 80% of people who experience cluster headaches are smokers. Cluster headaches tend to be described as an ice-like pain. And I'll be honest, I do not see a lot of people in my office with cluster headaches. It doesn't mean that they're rare and that they don't really exist. It just means that I personally don't see a ton of people in my office with cluster headaches. On the other hand, cervicogenic headaches tend to be caused by pain in the neck, and they tend to affect one side of the head. They can occur anywhere on the head and are often described as dull and achy. Pain from a cervicogenic headache typically comes from the joints in the neck and often increases with compressive forces. What that means is somebody gets up in the morning, they have to walk down the steps, that jarring force of step by step by step going down the steps really kind of jars their neck and their pain increases. Another example might be somebody jogging across the street to clear the walk sign. They get pain in their neck. Movement increases the pain in a cervicogenic headache. I see these types of headaches quite a bit, and I actually suffer from cervicogenic headaches about 3 to 4 times a year. Sometimes I sleep on my neck wrong. or I sit at my laptop too long, my neck gets really tight and stiff and the joints get a little bit stuck. When I see people in my office with this, I tend to show them a specific exercise with a towel that they can do to unstick themselves. Plus, there's a series of exercises that I do to complement that, and that helps them to stay mobile and unstuck. I do these same towel self-treatment and exercises on myself just to stay mobile. And I tend to do them, the exercises for movement, I do every day. And the towel exercise, I tend to do once a week or once every other week, just to keep when I feel like my neck's starting to get a little stiff. Another type of headache is the tension type headache, and it tends to be the most common. These are often described as a vice-like type headache, and they tend to occur on both sides of the head. Activity does not make a tension type headache better or worse. It's typically caused by a sensitivity of the nerves, which can then influence how the nerves communicate with muscle. I see tension type headaches quite frequently in my office as well. Even though the muscles aren't the root cause of the problem, the muscles around the neck get really tense because the nerves are hypersensitive to stress, poor posture, and even a cold environment. Think of the person slumped over at a computer all day trying to meet a deadline, and it's stressful. Their posture is not very good. Their body is tense. Their nervous system is tense because they're stressed. And if they're in a colder office and they're shivering, then that can even add more tension to the nervous system and the muscles. When I treat people with tension type headaches, I teach a lot about relaxation, self techniques to ease tension and stress, breathing correctly, and stretching to retrain the nerves to calm down so that the muscles will relax. A common treatment for tension type headaches is self-medication with over-the-counter medication. And what this can lead to is an analgesic rebound headache. So if somebody is self-medicating with the headache over-the-counter medication 3 times a week, as little as 3 times a week, they can actually start to increase their headaches when they start to wean off of those over-the-counter medications. So when I have somebody in my office, I actually ask them, how many times a week are you taking over-the-counter prescription medication for your headache? And if they say, oh, I take it like 4 or 5 days a week because when I go off of it or when I don't take it, my headaches increase. Well, we have to work through that. We have to get them off of the medication so that they can start to not have the rebound headache from the medication. Migraine headaches actually aren't headaches. Now, this may be new for you, but migraine headaches aren't really headaches, but instead, they are a disorder of the nervous system where a headache is just one of the symptoms of a migraine. I'm going to say that again because a lot of people think migraines are headaches, and they aren't. A headache is a symptom of a migraine. You can actually have a migraine with or without a headache. So what are some other symptoms? Well, a headache, of course, is a symptom. Light sensitivity, sound sensitivity, an aura. An aura is a visual field change or like flashes of light in the visual field. Some people will experience an aura and know that that's what is going to lead up to a headache. They know that a migraine. They will see an aura or a change in their visual field, a light or a flash of light, and they will know that within 15 minutes for some people, within 2 hours for other people, they are going to have a full-blown migraine. So an aura is often a symptom of an oncoming migraine, and it can be a warning sign. Migraine headaches tend to be on one side of the head. Nausea and vomiting are other symptoms associated with a migraine. In fact, 50% of people will vomit. I think the statistic is as high as 80% of people with migraines will actually experience nausea. Now, in children and in adults, There are abdominal migraines, also known as basilar migraines, and these occur because the vagus nerve traveling from the brain to the stomach will send a signal and cause a stomach ache or vomiting and nausea. And what happens is they're often misdiagnosed with gastrointestinal issues or stomach issues when really they are experiencing abdominal migraines. Abdominal migraines or basilar migraines are very typical of what is to come. And what I mean by that is if a child or an adolescent has abdominal migraines, they are more likely to have migraines as an adult. Migraines typically occur during the day instead of the night. They can affect mood. They can cause different sensations like numbness or tingling in the arm, the face, the lips, the tongue, even the teeth. Migraines tend to affect women more than men, and they can be genetic. Douglas Nelson does not say that, but I have seen many cases where a woman who suffers with migraines is more likely to have a daughter who also suffers with migraines. Migraines can be caused by the trigeminal nerve, which is a cranial nerve or major nerve of the face, and it influences the blood vessels in the face and the head. And migraines can also be triggered by points and specific muscles of the neck, face, and head. One of the most extreme examples that I have seen of a woman with a migraine is, I think she was 25 or 26, and she was a patient of my coworker, and she had had a hysterectomy. She had had a migraine since she was 15, and all the doctors in the medical field, they were convinced that it was hormone related. So she had a hysterectomy. Her migraines did not go away. It was not hormone related. And this was a traumatic surgery procedure that this young woman had that changed her life. And she had no relief. She came to my colleague, who at the time in that particular city was known as the specialist for treating migraines and headaches. And she was able to get relief after a few months of treatment. But the damage was done. She'd already had the hysterectomy, but she was still very, very thankful to not have migraines as bad. I believe that she still experienced them on occasion. They didn't go away 100%, but they were improved by 80%. So here was a young woman who went through drastic measures to get rid of her migraine through a hysterectomy, and her migraine did not go away. But the good part of that story is that she got the right treatment and her migraines did lessen by 80%. Now, why do I share that story? It's because people are suffering, and I want you to know that there are options. There are different types of headaches. There are different treatments for each of them. If I were to treat a person with a cervicogenic headache the same way as a person with a migraine, that would be catastrophic. The treatments are completely opposite. There are lots of options out there, and of course, medication is an option. And I say this as an option first because many people do actually need medication. However, many people do not, and there are other natural options. For example, there is the Daith ear piercing. This is a particular type of ear piercing that the way it works is in a specific part of your ear, it can influence like acupressure points, and it can help relieve migraines. And I've had patients in therapy doing very well in therapy have the Daith ear piercing, and I reduced their symptoms by 80%, and the Daith ear piercing reduced it the rest of the way. So I'm a believer in the ear piercing just because I've seen it work. Essential oils are another one. I've seen those work as well. And some people may say, oh, that's a fad, or that nobody understands how it works. Well, I've seen it work as well. I use essential oils at my office, and I've seen it be very effective as a complementary type treatment. Acupuncture, chiropractic care, these are other types of alternative treatments and options. Precision neuromuscular therapy, it's a medical massage technique that I learned from Douglas Nelson, and it has had tremendous results with people who have suffered for decades. And they get relief through the PNMT or precision neuromuscular therapy techniques that I do. As a physical therapist, of course, I'm going to recommend physical therapy. I've seen physical therapy in conjunction with the precision neuromuscular therapy do very, very well. There are specific exercises to address posture, relaxation, breathing techniques, stretching, strengthening. All of these combined work together to help relieve symptoms. And I would even say that I've had patients have acupuncture, chiropractic care, and physical therapy all at the same time to get that comprehensive approach. We all do different things and they all work really well. And when they're working together, it's the biggest bang for the buck, so to speak. Maintaining an ideal body weight to help promote overall good health definitely influences migraines and headaches. And food choices. Certain foods or allergies to foods can trigger migraines. Knowing what those triggers are can be very helpful in staving off your symptoms. So these are all great options. And for some people, they do need medication. For others, they can control their symptoms through treatment with a specialist and through changes in their lifestyle behaviors. One of the most important activities that you can do is to keep a headache diary so that you can track your headache's behavior and learn how your headaches behave. When you learn the behavior of your headache, then you can look at your own behavior and make changes. If every time you eat salty food, you get a headache, then you can change the salt content in your diet to prevent headaches. If one glass of wine gives you a headache, but grape juice doesn't, then you can drink grape juice instead to get the same health benefits of wine. If bright sunlight triggers your migraine, then you can wear dark sunglasses and close your blinds to lessen the trigger. The important thing for you to know today is that you can absolutely take control of your headaches and your migraine symptoms by tracking the behavior of your headaches and migraines and seeking a specialist to help you navigate through the process. I have treated many patients with headaches and migraines, and guess what? The treatment is the exact opposite. I mentioned this before. I had a lady come to me with a combination of a cervicogenic headache and a tension type headache. That's right. You can have two different types of headaches occur at the same time. For these two particular ones, I treated her joints, her nerve sensitivity, and muscle soreness. If I did that same treatment on the lady who came into my office with a migraine wearing dark sunglasses on a rainy day, the lady with the migraine would never come back to me for the second visit because I would have taken her symptoms and skyrocketed them through the roof. That's why when I see people sharing their headache and migraine home remedies online, I kind of cringe. What works for one person may be the exact opposite of what another person needs. Please be careful when you're posting information online. When people are in pain and they're desperate for relief, they're likely to try anything. And unfortunately, what they try may be the exact opposite of what they need, and therefore they are worse off. I hope talking about the different types of headaches and migraines has been helpful. I hope that if you are suffering with headaches and or migraines, that you feel more empowered to seek out a specialist. I encourage you to ask if they specialize in treating headaches and migraines. You need a specialist. And ask them to give you specific examples of success stories. You're not asking for names of patients, but you're asking for scenarios, kind of like what I gave you. I can honestly share with you that every person who has walked through my doors for treatment of a headache or migraine, I have a 100% track record in reducing their symptoms by at least 80%. That means a person who has walked into my office with a 10 out of 10 pain, meaning they have gone to the emergency department because their pain was that high. I have taken someone like that with symptoms that severe and have dropped them to a 0 out of 10, a 1 out of 10, or a 2 out of 10. If I could reduce your pain by 80%, how would that impact your day? How would that change and influence your interactions with the people you love? How would that impact your life? A colleague of mine and I co-treated a patient who had not taken a vacation in 20 years. Why did she not take a vacation in 20 years? Because she used all her sick time and all her vacation time for days off when she couldn't get out of bed due to a migraine. We treated her for 8 to 9 months. That may seem like a really long time. She had symptoms for over 20 years. It wasn't going to get fixed overnight. Now, we would have treated her 3 times a week in the beginning, and then as she was getting better, we backed off to 2 times a week, to 1 time a week, to every other week, to once every 3 weeks, once every 4 weeks, and so forth. So maybe we were seeing her in those last 7, 8, 9 months, like once a month, every other month. Well, she went on a cruise with her husband, and when they got back, her husband came into the office with tears in his eyes, thanking us for being able to enjoy his wife on a vacation. Now, that's a heartbreaking story that she suffered that long, but it is a jubilant story that she finally got relief because she got the right treatment. Please do not suffer for 20 years. Take action now, whether it's with me or another specialist. I encourage you to seek out help. I would actually love to help each and every one of you who's listening today. I would love to help your friends and your family members. I want to help you because I know that what I do changes lives. And I want you to have your life back. I want you to be able to go to a basketball game and watch your kid play without being afraid of the buzzer going off and setting off your migraine. I want you to enjoy the sunny day at the pool instead of hiding in the bed in the dark under the covers. I want you to experience life and live it. Please seek out a specialist. And if you want to reach out to me, you can visit dewittptwellness.com/services. Under the physical therapy aspect of that website page, you can click on in-office physical therapy if you want to come and see me in my office, or you also have the option of clicking online physical therapy if you want to have a virtual appointment. I do my best to reduce any barriers to care, so I offer availability in my office as well as online through a HIPAA-compliant video chat. I hope this has been helpful. I hope it's been encouraging. I hope it's been empowering. Until next time, be bold, be beautiful, and most importantly, be you.